and thank you for joining us. My name is Kelly.
And this is Mark.
And we're here with RRCU Financial Services. Today is the first video of our Medicare series. Today we're going to focus mostly on parts A, B, C, and D. So what is Medicare? Medicare is a federal health insurance program primarily for those age 65 and over. So Mark, can you go into detail a little bit on parts A and B for us?
Sure. Today we're going to talk about the complexity of Medicare and help answer all those hard questions that people have.
Yeah.
And first we're going to start with Part A. And Part A is going to be hospital care. So it's what you receive in the hospital. Also skilled nursing care, which is also what you receive in the hospital. So again, it's about the care from your doctor and your nurse in the hospital.
Okay, and what about parts B?
Part B is anything outside of the hospital or outpatient care. So doctor's visits, for just common things. Anything outside of the hospital that would be outpatient care is going to be covered by Part B.
And I know Part C is the Advantage plan,
right,
correct?
Right. That is
so
correct.
that can get a little confusing. So can you go into more detail on that for me?
Sure. Part C gets confusing, and that's why I always tried to remember it. When you hear Part C, I would always think of C, the Advantage. That helped me remember that. And what that means is Part C covers Advantage plans. And what an Advantage plan is it's a plan that is provided by private insurance companies that have Part A, Part B, and also Part D, which is your drug coverage, all rolled into one plan. Another thing that we need to make clear also is when you hear Part A and Part B, people are talking about original Medicare. And sometimes they use those terms vice versa. So they may say original Medicare and you would need to know, okay, well that's Part A and B together. Also, another important fact about that is when they go to enroll in Medicare at age 65, you must sign up for Part A. You don't have to sign up for Part B, but you do have to sign up for Part A. And then the other one, again, like you had mentioned earlier, was Part D. And I always remember D is very easy. D is for drugs. So any of your prescriptions that you're taking would fall under Medicare under Part D.
Thanks, Mark. That was so helpful.
You're welcome.
Thanks so much for watching, guys. Stay tuned for our next video.